We used 3 different compounding pharmacies, about 6 different flavors before I figured out which one my cat likes. I am a feline medicine specialist, and the day I had to start medicating my cat with 0.2 ml of liquid amlodipine every single day, that just completely changed my perspective on what we are asking from clients. So our residents very often, they send clients home with 6 different medications, and I'm like, I would not do that with my cat. So I'm like, you need to talk to the client and tell, this is the one medication that your cat needs to get.
Hello. Today I'm thrilled to welcome Dr. Petra, better known to many of you as the Crazy Cat Vet. She's a passionate advocate for feline medicine and has dedicated her career to making sure cats are understood and cared for in ways that respect their unique needs. In today's episode, we're going to focus on one of the most important stages of a cat's life, aging. From when a cat is considered senior, to the diseases they're prone to, and to the behavior changes we should watch for, and how we can adapt our homes and vet visits to support them. We'll be covering it all. This conversation will help you understand how to give your cat the longest, healthiest, and most fulfilling life possible. I'm Dr. Cara, your host. Let's get started. So I've asked you, as the crazy cat lady, how nice is it to come across a fellow cat lover and someone who also refers to themselves as a crazy cat vet? So very long distance apart, but where did the term come from? Why the love of cats?
Yeah, so I actually have always loved cats since I was a child, actually. So I've been kind of surrounded by mainly outdoor cats. So when I was a child, I was about 13, 14 when I asked my parents to get my first cat, and they were really not very supportive of that because I grew up, in kind of a small, we call it in Czech Republic, like a little town or village. And there were all these cats outdoors. So for my family, accepting a cat inside the house, it was very, very difficult for them initially. But I think that kind of started my motto of just persisting. And if you really want something to happen, it will happen at some point. And I was, I think, 14, and I got my very first cat. That was just mine, and he lived in my bedroom, and he was my cat. And so he kind of started all of it.
And what was his name?
His name was Cranberry. We called him CB.
Oh, so
yeah.
Cute. I must say, I love, and I think I didn't have a huge love for cats. I didn't have a huge understanding for cats. I was always more around dogs in my earlier career as well as my early childhood. Mm. I remember one cat that my grandmother had, and she was lovely, but I didn't ever really get to live with her. But as time's gone on, particularly working in small animal practice as sort of GP vet, I've just started appreciating cats, not only as patients, but now that I'm in a position to have both dogs and cats, I'm obsessed. I'm absolutely obsessed, so much so that I feel like I'm aging because, that is associated with aging women, that they collect and want to start hoarding cats.
I don't know. I've been collecting and cats all my life, Probably I'm still single, but I do love my cats more than anything.
Oh, no, they're wonderful. So I wanted to chat with, there are so many things, you're a specialist, so there were so many topics we could have discussed today. But one of the things I know that you speak quite a lot about is dementia and aging pets. And so we're going to focus our conversation around our senior patients, our senior pets. And I suppose my opening question for you is, what age do we define our cats now as senior? Because I think, historically it always used to be that 7+. And is that still considered the age that our patients are senior?
Yeah, I think that's a wonderful question. I think it's a great, I think around 10 years, it's really when they start getting to that older senior age. But 7 is that age where we really need to start by checking them out more at the vet and really bringing them at least once a year for annual blood work. But especially when it comes to blood pressure, I would say that's when we really start kind of closely monitoring them for hypertension and any of those senior cat comorbidities, because they could start developing around that age of 7.
And so what are some of the most common health issues that we are concerned about in senior cats that my listeners should be aware of?
Yeah, I think this is a great question because, of course, cats they are complicated creatures. I actually give a whole lecture for almost 2 hours that's called Complicated Cats, where we just focus on management and senior cat comorbidities, because cats not only just love to get more than one disease when they are, of course, getting older, but they also love to get diseases that are really, really hard to manage together, right? Like chronic kidney disease, heart disease, for example. Those are so challenging to manage together. But other things, I think 3 most common things would be chronic kidney disease, hypertension, and hyperthyroidism. So those are the 3 things we really need to monitor those cats really closely for.
And I mean, we're seeing our cats live longer, aren't we? I mean, is this because we are better about preventative healthcare measures? Why is it that we're seeing our patients live longer?
I mean, I would love to think that. When I read the statistics that more than 50% never see a vet, it's very, very sad. But I think that's one thing, that we are just definitely bringing our cats more to the vet than we used to. Another thing is this potentially is getting kind of a lot of scrutiny in some countries, but we keep a lot of our cats more indoors, so they are less likely, of course, to die of car accidents, get attacked by other animals. So I think that's also one reason why so many of them are going on and living longer.
I mean, so most of my listeners are pet owners, and they, we make a lot of assumptions, don't we, as vets, particularly, as we go on, we assume pet owners know what to look out for. But can you mention some of the things that cat owners should be aware of that may indicate that they need to see a vet? There is something not right with their pet.
I think that actually can be really challenging, because I'm a cat owner and a feline medicine specialist, and it can be difficult to notice some of those things. So I actually weigh my cats every 2 months to make sure they're not losing weight, because I think I got one of those like cheap baby scales, and then I just really keep a track of my cat's weight every about 2 months. But the main things to really watch out for is drinking, urination. Is the cat drinking or urinating more? Is there any changes in the appetite, any vomiting or diarrhea, changes in the stool? It can be difficult. I have 5 cats in the house, and it can be really difficult, right? When I wake up in the morning and there's vomit on the floor, it's really hard to tell which one of the cats it is. So I think that's why I'm really kind of keeping a track of everybody's weights and really focusing on that.
That's great advice. So simply, if you're an owner, how frequently should you be weighing your cat?
I think in your young cat, so if you have a cat under the age of 7, if you do that maybe 3-4 times a year, that will be the minimum. In those senior cats or those cats over the age of 7, I would say at least every 3 months, you really definitely should keep an eye. And if you have an older cat, like 10 years plus, even monthly wouldn't be too much.
So you spoke about multi-cat households, and that is, like you say, a complexity because most cat owners like to keep more than one cat. How do you monitor things like water or food intake? How do you manage to spot if there are changes?
And this is, I think, one of the most challenging things that we see in practice. I, of course, try to monitor the water intake by, like, when I'm at least on weekends, when I'm not at work, I watch my cats and see which one's drinking the most, because I actually purchased one of those microchip centered kind of water bowls. And it was a problem because 2 of my cats love to play with water. So I kept getting alerts that, like, this one cat is drinking so much, but she was actually, like, spilling it from the bowl. So it can be quite challenging sometimes.
Oh my word, that is difficult.
Yes.
So visually watching it is really important to monitor. What are the other things that you can see visually? And I mean, obviously, some owners may not see a slow change in weight, so the weighing of their cats is really important. But what are the other things they might visually see or behaviorally see that might indicate that there's an issue?
Definitely things like slowing down. So some of these cats, of course, as they age, and one of the diseases I didn't mention before was osteoarthritis. So the cats can be like changing and jumping up and down. Maybe they no longer want to be scratching, which is a big sign in older cats with osteoarthritis, because if they develop pain in their joints, they don't want to be scratched as much. So actually overgrown nails are usually one of those signs of osteoarthritis in those cats. I think visually watching, I am of course a veterinarian, so I like just by touching them, I try to feel for their body condition score and all of that. But not every owner probably is able to do that. But other things to watch for would be definitely the food intake, right? Like most cats, if I have a cat that's been eating the same food and loves the same food, and suddenly is leaving food in the bowl in a cat that used to finish the meal every single time, that's always a concern. And I actually think cat caregivers and cat owners are so amazing and really advocating for their cats and bringing them when there's just a little thing. Like for me, for example, one of my cats, when I diagnosed her with GI lymphoma and I realized she was unwell, was that she stopped sleeping with me whole night in the bed. So you would think, this woman is crazy. Like, why is she bringing her cat to the vet? Because she stopped sleeping with her in the bed. But it was just something my cat did for 11 years. It was my one certainty in life that this cat sleeps on my pillow. We kind of have a pillow fight with my cat. And she always wins, by the way. But that's the one thing that suddenly for 2 nights in a row, she didn't come to bed. And then I knew there was something going on.
Hi there, pet parents. This is Dr. Cara, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little ones strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? Ultra Pet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. How do people distinguish between normal age-related change and ones that should be red flags?
I think one thing would be if it's really acute onset and suddenly something happening fast. If they see like slow decrease in the, for example, cat's appetite, then I think the appetite is always a concern because cats want to eat, they want to survive. And when the cats stop eating, that's always kind of a red flag to me. But things like if the cat suddenly is scratching a little bit less, slower over the time, or is wanting to sleep somewhere else, these are probably maybe changes that might be in their cognitive changes, but also potentially osteoarthritis. But if it's a really acute change, like suddenly the cat is under the bed where they never want to hide, I think they need to bring them back because the cat's telling them, Mom or Dad, I am like sick right now.
That's great advice. And obviously, as our pets start to age, we as owners want to put in some adaptations in the home that can make them feel a little bit more comfortable, or just accept that they're aging and they may need sort of assistance, either accessing food or their favorite place. What are some of the considerations that you can advise pet owners to look at?
Oh, thank you for asking this question. It's one of my favorite things. So environmental kind of modifications. And I think we're actually getting away from the term enrichment because, we should not be calling it an enrichment because that's the standard for the cat, not really something special. But I really love this. So if you think about it, especially in multi-cat households, most of the times we really try keeping our resources really far away from each other so that each cat can have access to the resources without other cats around. But in those senior cats, especially those with osteoarthritis, mobility, other mobility issues, cats that having cognitive decline or dementia, we really want to bring those resources together so the cat doesn't have to move around and look for those things when they're, in that 18, 20 years of age and they are just not able to move around as well as they used to. So like making sure we are bringing their favorite bed and their food bowls close to them. I really love those elevated kind of food bowls where the cat doesn't have to bend its neck, because when they have osteoarthritis, it can hurt. And on the other hand, providing like a really low tray litter box where the cat can get in and out of it comfortably, even with osteoarthritis, is super important. I just saw this other day, this litter box that the cat actually had to go almost through like a labyrinth to get in and pee. Like the cat had to jump up and jump into the box. And people were selling it like it was so great because it doesn't make mess in the house. But I'm like, well, but if the cat can't get really into it and is peeing outside of the litter box, then it's probably making more mess in the end. But yeah, so we very often think about like stuff for our cats, what is convenient to us, but not always what is actually in the best interest of the cat.
And if we go back to your comments on enrichments, are there things that you should be mentally stimulating our senior pets to do? Should you be trying to engage with them more, or is it best just to leave them be?
Oh, this is another great question. So I actually do love if the cat is able to still move around and we are just trying to stimulate them. I do love using food puzzles, for example, if they can have treats. I would want to make sure they still have access to their normal food, but if they want to, they can have access to these different puzzle feeders. And then play is, of course, very, very important. If the cat still wants to play, I love those, feather wand toys or other kind of toys that you can play with your cat. And then one more thing I forgot to mention before was, especially if the cat's most of my cats love to sleep on the window. So they really, love to be there. So if they're getting old and they can't jump up there, we should provide them with those little ramps, or, the cat getting onto the bed. We can provide them with little ramps where they don't have to jump, but they can just walk up those ramps to get still to their favorite places.
Oh, that's so important, isn't it? Mm-hmm. Especially when they want to sit on the couch with you and they otherwise can't get up.
Mm-hmm.
Yeah. And how important are the regular vet visits for these senior patients? You made mention, obviously, particularly to weigh them, but what are the kind of things that vets would very quickly, without a big expense, because I know that sometimes is the hesitation to visit unless there's something wrong. What about like routine vaccinations?
Yeah, I think vaccinations are, of course, important, especially according to the new vaccine guidelines. They're actually much more important in our young cats. So we try to now get more into the vaccinating a little bit more often in our kittens because of the maternal-derived antibodies. So the antibodies those kittens have from their moms that can interfere with those vaccines. But actually now we're all like a middle-aged to senior cat. Most of the vaccines we have now on the market actually last 2 to 3 years. So we might not have to really vaccinate our senior cats, especially those that are indoor-only cats and really have access to other unvaccinated cats outdoors. We might not need to vaccinate them as often as we used to in the past. That's just the kind of the newest recommendations which we have now, which brings the problem that maybe those cats are not getting annually to the vet, right? So that's a big dilemma there. But I think I'm really a proponent of trying to start these feline senior vet visits where, and a couple of my friends who run their feline specialty practices. I'm in academia, things always take much longer to change there. But I do have a couple of my friends who run their cat-only practices, and they actually have their senior feline visit, and it actually includes blood pressure at every single visit at no cost to the client. So, which I think is very, very important. So they don't even kind of negotiate on doing a blood pressure. So any cat over the age of 7, every time they get in, it's part of the basic physical exam is the blood pressure measurement. And my own cat, the love of my life, actually was just diagnosed with hypertension in January. So it's a disease I'm extremely passionate about now. And I do think and I do wish every vet in the world would just have a blood pressure as a standard of a physical exam in those cats 7 age plus.
That's great advice. And should these senior pets be seen more frequently than once a year? Would we be recommending every 6 months?
Yes, I think that would be, of course, ideal in my world, because things can change. Kind of very, very fast in these older cats. So I think if the cats could come at least twice a year, at least for the weight check and then the blood pressure measurement, we don't probably have to do in those like 7-year-old cats if the blood work was fine. But in those older cats, you would really be surprised how much things can change on just a basic blood work within even 3 to 6 months. So in my ideal world, all of our senior cats would come in at least twice a year. My own senior cat, she just turned 11 this year. She goes in 4 times a year for her blood work. So I might be overdoing it.
You're a very good owner. You definitely want to spot things before they progress.
Absolutely.
So one of the things I hear quite a lot is that owners are reluctant to bring what their cats are very sensitive, and what they feel is a very stressful event. They don't want to bring their pets to the vet for that reason. What is your advice for trying to ease the stress for both the owner and for the cat?
Yeah, no, I think this is, and it's great we're talking about it, because there was August 22nd was actually the National Bring Your Cat to the Vet Day, right? Which we all want to motivate clients to bring the cats to the vet, but we need to be honest, it is very stressful. Like, I am a veterinarian, and just bringing the cat with me to the work is very stressful too. I usually never bring more than 1 or 2 with me, just like getting the stuff ready, because the night before, at least, the carrier really needs to be out for the cats to get used to it. So it's a long preparation for this vet visit, right, with the cat. Dog, you put them on a leash and you just take them to the vet. But for a cat, it's really a long process to make it as cat-friendly as possible. So we pre-medicate them. So we have medications like gabapentin, or now we have the great pregabalin that's actually compounded. It's a liquid, really kind of palatable and tasty solution for cats as well, which is amazing. And I really love that there are so many companies out there actually realizing the need for feline specific medications that just like human meds or dog meds, they're not just going to cut it for cats, right? Because kids are very picky with their meds. I do love that we are making highly concentrated medications that just require a small volume to the cat, but also that they are palatable, of course, to the cats, and they taste well. And so pre-medicating the cats and giving them these medications that can kind of decrease the stress of coming to the hospital. We have so many studies showing that these medications have a really good effect on decreasing the stress from the vet visits for these cats. Using some pheromones, for example, in the cat carrier, and then really leaving the cat carrier 1 or 2 days out. Because if I want to bring my cats in the morning with me to the vet and I bring the carrier out, they see it, there's no way we're making it to the vet that day, right? Like, it is very, very challenging. And then it comes, and then a lot of it is also on us as vets, because we really need to provide some quiet waiting area for those cats ideally. And if we do not have it, maybe the cats should wait with the clients in the car until we can get them into the consult room if they're very anxious. My cats have never seen a dog. I get anxious when I hear a dog barking. So, it will be very stressful for those cats. Cats have an extremely developed sense of smell too. So they can smell. They can smell other cats. They can smell other dogs and other pets, of course, exotics as well. Which, again, in the nature, I try explaining this to people that cats are in the nature both predator and prey. So cats, of course, even though they are these strong, independent creatures, they also have very strong protective emotions. And I don't know if I should start this topic, but I do get extremely upset when people call cats aggressive, because I do not believe, and we now have guidelines that say no cat is aggressive. We actually know that these cats are just very stressed and very worried, and they are showing very strong protective emotions, which is completely natural to the cat.
So how do we as veterinarians work with these cats? Is it a case of making sure that the consultations are long enough? How do we set up our consult room? Can you give us some top tips?
Yeah, and this is another great question. I think it's difficult now in a world where most practices are bought by corporates, right? Everything is just you need to see this amount of patients in this short period of time. I personally believe that most of the feline clients do not mind paying a little bit longer if their cat is treated right and there is more time to work with their cat. So some of my, I see it quite a lot that there is a dog visit that takes, 15 minutes and a cat visit that's 20, 25 minutes. It's maybe a little bit more expensive, of course, but most people do not mind that. Like I have clients driving and coming to me for hours because they know that their cats then come home and they don't jump and hide under the bed for 2 days after the vet visit. So just taking a little bit more time, but talking to the clients about prepping the cat for the visit, and then we so underestimate how food motivated cats are. So cats love all these different types of treats. They don't want to be restrained, right? So I kind of am I feel like I'm a cat myself sometimes, because the second you push me to do something, I'm not going to do it, or if I'm going to do it, it's not going to go very well. So just working with them, motivating them to do things on their own terms. So I always feel like if I need more than me and one person feeding the cat to get stuff done with the cat, we should probably reach out for some sedation methods, for example, to help us decrease those protective emotions for those cats and be able to work with them. But most of the times, I feel like, especially when we start seeing kittens, that's the one time where you can really work with kittens. Kittens are so great to work with. They can be so kind of receptive to food and positive reinforcement. And I learned that when I did my clinical trial actually for feline infectious peritonitis, because we had all those really sick kittens coming in every month for rechecks. And now these cats grew into, healthy 2-3-year-old cats who are still very good at vet visits because we've just worked with them. We use a lot of positive reinforcement when they're coming in as kittens. And just when I saw a little bit kind of those protective emotions being on a rise, we, talked to the clients about gabapentin, about all these other things. And I do feel like these kittens are now set for success. And I think it's sad because we do see a lot of those puppy classes, where people bring their puppies to the vet and they talk about these behavioral things. And we can't really do people bringing 15 kittens to hang out together because it's horrible from infectious disease standpoint. And the cats are probably not going to be happy. But you could do a private kitten class, right? Where the kitten just comes in, doesn't get any vaccines, doesn't get anything, and you just give them treats. So they know that you as the vet, you're not the bad guy who pokes them and probes them. You're the good person that gives them those treats, right? So I think we should start working much more with those kittens and setting them for success for their senior care visits in 20 years.
Oh, that is a really great idea. I mean, even down to traveling in the car and not having it end with, an injection or having your temperature taken. So, but talk a little bit more about how you manage your cats in the car. Where's the best place to put them? Is there really a benefit for playing cat music? Does it help calm them? Give us some top tips on traveling in the car.
I love that question. So I actually am so cats seem to love from the studies we have. And again, you would think cat people are crazy people that they do studies trying to understand which music cat likes the most. But I do think it makes sense because, again, cats in nature being predator and prey, their hearing is really well developed, right? Because they want to hear their prey, but they also want to hear all the other animals that are there to hurt them. So we actually, from the studies we have, it seems that cats seem to like classical music, and it's actually one of my favorite musics as well. But the whole point of that music is we're not playing the music for the cat to be happy. We are kind of playing the music because it decreases all the other noises the cats would hear in the car. One big thing that I also would recommend is kind of having carriers. Two things about kit carriers, and we could probably talk about kit carriers for a whole day. But kit carriers, one, that they need to be able to be kind of, you need to be able to use the seat belt to like lock them in place, because if you put them in the back of the seat and the carrier is just like moving right and left the whole time, it's not very good. The cat might get nauseous and just not be too excited about the trip. And number two, if you like your vet at least a little bit, please get a carrier that you can open on the top very easily, because I absolutely hate dragging cats out of the carriers. And twice in my life, I actually refused to see a patient because we couldn't get them out of a carrier. And it breaks my heart. I will not stress a cat. And so I talked to the clients. I sent them home. We didn't charge for the visit. I said, this is the cat carrier, or 2 cat carriers I recommend. Go get one of those and please come back next week. And
I take it was much easier.
Oh my God. But also for the cat, like it was just such a huge difference, because I could just open from the top. We could start offering treats rather than me like diving into this huge carrier that the cat is just flying right and left in the air. So I really think the choice of a cat carrier is very important.
And how do you improve owner compliance, particularly if you are recommending administration, say, of eardrops or tablets, which is like a swear word for cat owners? They're like, please don't ask me to administer medication. What is the top tips, or what is the way that you can sort of make this something that they'll complete the course, for example? Because I know that is not always easy if you haven't had to do it before.
Mm-hmm. And actually, it is not easy even if you had to do it before. So I really think I am a feline medicine specialist. And the day I had to start medicating my cat with 0.2 mL of liquid amlodipine every single day, that just completely changed my perspective on what we are asking from clients. So one big tip is really trying to, because we can compound these days so many medications into transdermal gels or liquid medications. Some cats actually prefer pills to the liquids as well. And so number one thing is really trying to figure out, and now you'll be laughing again, but this is why I really am proud of being the crazy cat vet. We used 3 different compounding pharmacies, about 6 different flavors before I figured out which one my cat likes the most, because we used one that was like a chicken, and she was just like hyper salivating every single time. I think it was just a bit bitter still. So she was like hyper salivating every single time I gave it to her. Twice she even vomited after the medication. It is very stressful for you as a, cat owner. So we now have this surprisingly, she seemed to like marshmallow flavor, but we do have this like marshmallow flavor now, amlodipine. And I actually know the only way I can give her meds is when she's getting her dinner, because she loves her dinner time. So that's her favorite thing in the world. And that's the one time when if I give her meds during her dinner time, I always have her start eating a little bit, then come and give her the meds, and then she finishes her dinner. And it's like the one time where I feel like she doesn't hate me afterwards for the rest of the day. So it's these little things, just really trying to find the time, the best formulation that works the best for your cat as well. And I always try giving treats before and after. So sometimes she would even take the medication with a little bit of churro as well. So I have one of my friend's cats is on a cyclosporin for his allergies twice a day. And he gets like a little bit of, she makes like a little circle from the churro treats, the liquid kind of treats for cats, and puts the cyclosporin liquid in the middle. And he loves it. The cat just sees it and he's so excited because he knows the treat is coming. So you definitely can, again, positively work with your cat and associate the medication with something positive, like a dinner, treat or something else your cat, like a playtime. If your cat, because some cats are differently motivated. So if play is what motivates your cat, then maybe playing a little bit, giving the meds, and then playing again with them would be great. And I, again, have to say that because I'm just actually adopting a congenital hypothyroid kitten very soon. And he is already, so he's being raised by an amazing feline vet tech. And she already, like, the cat sits and screams for his medications every morning and evening, because she trained him to really that this is when he gets his treats, this is when he gets everything he loves. So he just sees the bottle and he like sits and gets so excited about it. And again, this is where we work with those kittens, and that's what I've learned from my clinical trial, because we had 73 cats that clients had to medicate twice a day for 12 weeks. We didn't have a single dropout of a client not being able to medicate their cat. It was just because I showed them, covering, and those were pills, or those were all capsules. We couldn't compound it in a liquid. But then we covered the capsule in some of the churros. I showed the clients, give them a little bit of treat, give them a little bit of the medication, then give them a treat again. And just spending, and I think this is a place in veterinary medicine where we can really empower our veterinary technicians to really spend 5 to 10 minutes with the client, showing them these things. Because I think that, again, sets the client for success. Because if you just send a client home with a bag of meds and says, this is what you have to do, it just is not going to go well. And we very often see medical management fail because clients can't do it, because it's ruining the bond with the cat. It's stressful. Like, I feel like I'm a terrible owner if I can't give the medication that I'm supposed to give.
Absolutely. And I think you're right. If you don't say to owners, if you are struggling, please come back to us. We have other suggestions. We have other techniques. Then you have the risk of that pet not receiving medication that is needed, particularly in our senior pets.
Yes.
Yeah, very much so.
Yeah. And I actually do see like our residents very often, like they send clients home with 6 different medications. And I'm like, I would not do that with my cat. So I'm like, you need to talk to the client and tell, this is the one medication that your cat needs to get. If you can get the second and third, great. If you can get all of these in, perfect. But if you skip these 3, your cat is still going to live and be okay, So, because I think we do need to also kind of differentiate, if it's a hypertensive medication, that the cat's going to die without the medication, right? But if it's like some probiotic supplement, the cat will probably be okay without it. So we really should differentiate also on the priority of the medications that needs to go, because again, with dogs, if you have a 20-kilo Labrador or, 40-kilo Labrador who will eat anything at any point, it's so much easier to send them home with 6 medications than my cat that hates any medication, right?
And you don't want your cat to hate you.
No.
So that is really good advice. That is really, really good advice. Can we take a moment to discuss the role of nutrition in supporting our aging cats? And are there any specific diet changes that you would recommend or advise owners against?
Yes. So I think in our senior cats, we of course want to, so the kitten has completely different nutritional needs to that senior cat. So I do think there is a time in life where the time comes and we need to make some dietary transition. Number one thing, I think this really needs to be done very slowly, especially in our senior cats, because cats can develop food aversion. So the time to change the diet is, you don't want to change the diet when the cat's already not eating, when the cat's unwell, especially if they're nauseous, vomiting, because they can associate the new diet with those clinical signs they were showing too and really develop food aversion. You also don't want to do it too abruptly, especially in your senior cats, because when kids get older, their like threshold for like tolerance is much lower as well. And they definitely can get upset very much easier and much faster than they did when they were younger. And we see that when we age too, right? Things I could like tolerate when I was younger, and I'm like, there's no way we're doing this right now. So I do think things really need to happen slowly so we do not cause harm, because we don't want that senior cat that might already be losing weight to suddenly stop eating. So that's very, very important. 2, of course, our cats, especially with so many cats developing chronic kidney disease and potentially needing lower protein and lower kind of phosphorus in their diet, it might also be important to start transitioning them to these senior diets. But we do also see now studies where cats' phosphorus is actually not low enough. And when we start restricting the phosphorus too early, they can actually develop this rebound hypercalcemia. So I would recommend that you always talk to your vet when you want to do dietary changes. And I think, raw feeding is definitely big on the list, and people talk about it quite a lot. But I do think those young kittens, when their immune system is not developed, and those senior cats that might be more prone to infections again at that time point of the life, raw food is maybe not the best option because they might be more likely to develop infections from those diets too.
Very good advice, that. Thank you for sharing. So when we're talking about, and I do want to go down the path of discussing dental hygiene and dental care, but before we move on to that subject, what about wet food? Is that something that, just in terms of hydration, that might be something that owners would want to consider as their pets age?
Yeah, I think I love, of course, canned food. So if you think about it in nature, what is the food that the cat would eat would be usually what their prey, right? So mouse, bird, or whatever they catch. And it's about 60% of water. And then we go and put all our indoor cats on these dry foods that, of course, do not contain much water at all. So it is actually very important. And there are some cats that do not like to have the canned food, and they're just, picky, but it's just not what they like. But otherwise, my cats are addicted to canned food. So like if by 6 p.m. there isn't canned food on the, canned food dinner, I'm in trouble. So I do think it's very, very important to do that. The one thing I just want to make sure people understand that most of the canned foods, to get the same amount of calories into the cat when they have canned food, you need much more amount of the diet as well compared to the dry food, because usually the kibbles are much more calorie dense versus the canned food. So just making sure if you're making any changes, especially in your senior cats, you want to make sure that you are maintaining the calories the cats need. So it might be much more of the canned food you actually have to give those cats to keep them up on the calories they need to take every day.
And can you now talk about the role of dental care in longevity for cats and why it's important?
Oh, that's a great question. I'm actually not a dentist, and I think it's very scary to deal with teeth. I've seen severe complications. My kids have their own personal kind of a dental specialist, but I find it quite interesting because I'm of course an internal medicine specialist. So sometimes people come to me and they are willing to spend thousands and thousands of dollars on all these diagnostics, but they don't want to do like a dental that costs third of that price. And I actually think it's a huge problem because cats, of course, get those resorptive lesions. They have plaque that can then contain a lot of bacteria. They, of course, can, especially, for example, if you have a diabetic cat with bad teeth, like that can result in insulin even resistance and complications with their diabetes and other diseases. So I actually get my cats, we have a special saving spot for dentals because we do see a board certified dentist with my cats because like I said, I had seen quite a lot of complications from dental. So I want to make sure my cats go and see someone who has dental radiographs and really they get a good dental care because, again, cats being cats, it's so much more complicated to dental in a cat versus a dog. And so I think it's super, super important that people keep up on the dental care. And I think sometimes it can seem like it's a lot of a cost, but I think just making your cat comfortable and being proactive about it is much better than dealing with it when the cat is very senior, very old, and has all these other comorbidities that might put her at higher risk, for example, for the procedure.
And how do you approach conversations when it reaches that end of life, quality of life, and when euthanasia might be the kindest option? How do you deal with that?
Yeah, this is probably, I think, the most difficult, of course, conversation we have to have with our clients. And now, having a senior cat myself, and I have a friend who she just recently lost her senior cat, and it definitely is a conversation that is very, very difficult. I think euthanasia is a great really option for pets that are, really at the end of the life, and it's a kind way to really help them be comfortable and when they are no longer able to do all the things they want to do and they stopped eating, rather than watching them go through really slow and potentially even uncomfortable and painful process. Euthanasia it's a great thing. We do not, of course, have these options when we age as humans in most countries. So I think we should look at it as a kind thing for our pets that, when we have reached that time. I do believe, cats are these special creatures who have 9 lives and they really want to live. But there comes the time, of course, where we have done so much for our feline patients and as cat owners. And when the cat's no longer eating and really enjoying, and you can just tell that the cat is not what they used to be. So I think that euthanasia should be considered as a kind of a kind gesture to our cats and just letting them go. But it is a difficult one, and I actually, now being in the United States, it is a completely different actually process than when I used to live in Europe, because for a lot of personal, ethical, religious reasons, very often actually some clients do not want to consider euthanasia. So then we actually created, or the Feline VMA and the iCat Care, they created amazing, we have a palliative care guidelines as well. So I think for us as vets, they are amazing palliative care guidelines for cats for hospice care. If we have clients who, for whatever reason, of course, they don't want to elect euthanasia, and we need to respect that decision, there are still a lot of ways we can help our feline patients in those last kind of days of their lives.
That is really helpful. And I know we're running out of time. And as you said, there's so many things we can discuss. But before I lose the opportunity, I think my closing question would be, is there anything you'd love every cat owner listening today to take away about caring for their older cat? What would that be?
I think number one thing is be a good advocate for your cat. So I think, you know your cat the best. So if you do believe there is something going on with your cat, please make sure you raise those concerns when you come to see us, because I do take even little behavioral changes very seriously. Number two is please try to work with your vet. We are not your enemies. We really are not your enemies. We love pets. We love cats, and we are here to help you and your cat and, live those golden years. We want your cats to, of course, live it as best as possible. And so try to find a vet that you trust them with the care for your cat, and try to work with them, because even though the cat visit to the vet can be a stressful, of course, moment for the cat, we can do so many things to decrease that stress. And of course, very important about that is that we can then help with all of the conditions that the senior cats get. And we want these cats to live and make it to at least 20, right? And just have a great quality of life. So we are here for you, and I think us working together to really improve the quality of life of your cat is very important.
Thank you, Dr. Petra. This has been a really informative. I've thoroughly enjoyed our conversation, and thank you for taking time out of your busy day, a very early start to your day. So I'm really, really grateful for your time. And there is so much to gain from this conversation.
Thank you so much for having me here. I always love to talk about cats at any time point of the day. So thank you for having me.
Oh, thank you. Thank you so much to Dr. Petra for sharing her wisdom on caring for our aging cats. Her passion for feline medicine is contagious and reminds us all that cats deserve care that's tailored to their unique needs. If you'd like to learn more from her, follow her on Instagram @crazycatvet. And if this episode gave you new insights into your own cat's care, please share it with a fellow cat lover, subscribe to the podcast, and leave us a review. It really helps us reach more pet parents like you. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.